Welcome to our presentation on sexually transmitted diseases among the elderly. We hope you learned something new today. It is a common misconception that sexually transmitted diseases are a problem faced largely by teenagers and young adults. The reality is, STDs are rising in individuals age 60 and older. Research has shown that STDs are increasing in older adults as a result of risky sexual behaviors, including lack of condom use and decreased monogamy. Although research and data analysis have shown a rise in STDs among older adults, STD testing rates remain low among this population. According to literature review, healthcare providers are omitting a vital aspect of the comprehensive geriatric assessment, the sexual health history, and are missing opportunities to identify and screen patients at risk for STIs. The purpose of this project is to highlight the importance of this issue in today's society, explore evidence-based strategies nurses can utilize when discussing sexual health with this population, and provide education about safe sexual health habits. Sexual health and sexuality have been shown to be an important indicator of quality of life among older generations. It is a topic that is often overlooked and under-discussed by healthcare providers. Nurses play a role in this growing public health issue. So how do we better understand and tackle it? STIs such as chlamydia, gonorrhea, and syphilis are on the rise among older adults. However, only 1 in 3 older adults at risk have ever received STI testing. Less than 20% of heterosexual people aged 57 to 85 years old have ever been tested for HIV. Unfortunately, gaps exist in literature related to lesbian, gay, bisexual, and transgender elders' sexuality and sexual health. Most surveys ask only about their sexual activity and never inquire about sexual health of LGBT folks. This makes it difficult to gather accurate data on LGBT elders and their sexual health. Timely screening and treatment is essential as older adults are more likely to experience a late-stage diagnosis. A late-stage diagnosis of HIV is particularly challenging because they are at risk for mortality and are less likely to respond to treatment. Often people who are diagnosed in the late stage were seen as a low risk for STIs by their provider. So when we perceive older adults as not being sexually active and do not screen them for STIs, we are putting them at risk for a late-stage diagnosis. Healthcare providers report being reluctant to discuss sexuality and STI-related topics with older adult patients. Providers worry about embarrassing or offending their patients, even though, according to Farrell and Belka, most older adults report being unlikely to be offended or embarrassed if a nurse were to bring up their sexual health. So why are STIs on the rise among the older population? Research suggests that thanks to products such as Viagra, older people are having fulfilling sex well into their 80s. In addition to Viagra, which is used to treat erectile dysfunction, there are new lubricants which combat vaginal dryness, which is often seen later in life. With the age of the internet, seniors are able to find tips and tricks online to maintain a fulfilling sex life far into their golden years. A study conducted on patients over the age of 50 showed that only 12.5% of them reported always using condoms. Lack of condom use in older adults is usually linked to infertility and lack of knowledge. The AARP reports that most older adults think that they aren't at risk for STIs. Folks need to be educated that condoms aren't just used to prevent pregnancy, and risk for STIs is lifelong, as long as you are having unprotected sex. There's also a lack of monogamy that occurs after a divorce of a couple or the death of a spouse. Many people who have been in monogamous relationships via marriage for many years and then lose a spouse to death or divorce may have missed out on the message about STIs and STDs. The older generation was presented information about STIs and STDs in a stigmatized way that, instead of building knowledge, increase shame and stigma. The CDC tracks and reports incidences of STIs. Here are some stats to show the rise in 3 common infections: chlamydia, gonorrhea, and syphilis among older adults. Older adults who are sexually active should talk to their healthcare provider about STI testing. However, in one study by Farrell and Belka, most older adults identified as being willing to discuss their sexual health, but feel that nurses should be the ones starting the conversation, not the patient. One way to combat the risk of STIs in older adults is to have open and honest communication with our patients, and research shows that our older adults patients expect us to engage them in these conversations. Nurses miss opportunities to connect older patients to education, referrals, and support by never inquiring about sexual activity and sexual health. Screenings for STIs should occur once a year for sexually active older adults, and all adults should be tested at least once for HIV. Trichomoniasis screening should be conducted at least annually for all women who have already been diagnosed with HIV. So, what are the implications for the nursing profession? As nurses, we must identify older adult patients at risk for developing STIs. This includes community dwelling adults, nursing home residents, folks who live in assisted living, as well as those living in long-term care. For older adults with dementia, living in long-term care can provide its own set of sexual health challenges. Nurses in these facilities must take steps to create an environment that allows for safe and healthy sexual expression, that is empathetic to residents' needs, and treats them as mature adults, rather than people who need to be policed out of fear of legal or medical repercussions. One care home in New York has created a special comprehensive training called Freedom of Sexual Expression, Dementia and Residents' Rights in Long-Term Care Facilities. It is trainings like these that will elevate the nursing profession to encompass sexual education for older adults that creates an atmosphere for safe and healthy sexual expression. We must also recognize our biases and personal attitudes about sexuality in older adults. Examine your thoughts and feelings about older people and sex, and challenge your biases when talking with these patients, even if it makes you uncomfortable. Recognize that each older adult has unique preferences and sensitivities when discussing sexual health. Use those preferences to help develop your care plans and communication strategies when interacting with them. Be sensitive to verbal and social cues. Be sure not to assume that your patient is heterosexual just because they're an older person. It may also be helpful to use anonymous anecdotes, like saying, some people experience feeling like condoms are no longer important after menopause. Have you noticed anything like that in your experience? While others may need more direct approaches to the subject. Develop a therapeutic and empathetic relationship with older adults to help build trust and allow for open communication. Use affirming language around sex and show support for continued sexual activity as we age. Validate older people's feelings around sex. Never act shocked or surprised when an older patient brings up sex. Recognize sexuality as a potential indicator of quality of life for some older adults. Understand that loneliness does not have to be a standard part of aging, and it is appropriate as a nurse to encourage dating and sexual activity among older folks who may be feeling lonely. Develop strong and effective communication skills, as this is an important factor in discussing sexual health. You must be confident and competent to talk about sex if older folks are going to trust you. Nurses can play an even bigger part in sexual health education by increasing personal and public education to reduce the stigma of STIs, homophobia, and ageism in healthcare. Normalize talk about sexual health by avoiding stigmatized language. Recognize that LGBT people, especially elders in that community, face significant barriers to healthcare, so providing a safe place for them to talk about sexual health and sexuality is incredibly important to their overall health and well-being. Avoid ageism by recognizing that older folks do have sex and also need education about how to stay healthy while maintaining an active sex life in older adulthood. Educate older adults on safe sex practices, risks for acquiring STIs, and prophylaxis strategies. Don't assume that older folks know it all about condoms, STIs, and other things that come along with sexuality. Other generations did not talk openly about safe sex and STI risks, creating an environment for people to feel shame and stigmatized instead of educated. Recognize the potential impact of certain health conditions and medications and how they impact people's sexual performance and sexual health. We also need to provide referrals, social support, and educational materials. Support groups, therapists, printed materials, online resources, all those things normalize sexual health issues and provide education and safety for older adults who may be facing a new diagnosis or may be new to sex with someone other than their spouse. We also need to target HIV prevention efforts towards older adults, recognizing all these other factors that we've talked about. People are having sex longer, and they're often not using condoms. We also must remove personal bias and attitudes when determining who needs STI testing. Challenge yourself to think about STIs in a new way and help end the taboo around sex by openly talking with your patients about sexual health. Don't skip the sex section of your assessment and use the opportunity to educate and connect with older folks who may be waiting for you to start the conversation. We also need to promote more qualitative and quantitative research on STIs and HIV among the elderly. Talk to your supervisors about the importance of the topic and opportunities for research or quality improvement at your facility. The burden of initiating the conversation about sex should be lifted off the older adult and put on the nurse, whose role it is to facilitate the best health outcomes possible for their patients. For further reading or to review our references, take a look at these articles. We hope you've all learned something valuable today and are able to incorporate this knowledge into your daily nursing practice. Thank you.